Mitral stenosis. Mitral stenosis is a disease where the mitral valve, which lies between the left atrium and the left ventricle, becomes narrowed. Normally, the valve opening is about 4 to 6 square centimeters. When it is less than 2, symptoms begin. And when it becomes less than 1.5 square centimeter, we call it severe stenosis. The most important cause is rheumatic fever. It causes the valve leaflets to become thick, rigid, and sometimes calcified. The commissures, which are the junctions of the valve leaflets, fuse together. This gives a classic fish mouth or buttonhole appearance. The chordae tendineae, which normally keep the valve flexible, also become thick, fused, and shortened. These structural changes narrow the valve opening. Now, let us see what happens inside the heart. Because the valve is narrow, the left atrium cannot empty properly into the left ventricle. This makes the pressure inside the left atrium rise. With this, the left atrium gradually enlarges or dilates. This often leads to atrial fibrillation, which is an irregular heartbeat, and also increases the risk of clot formation. The high pressure in the left atrium is transmitted backward to the pulmonary veins. This causes congestion in the lungs. Patients feel breathless, especially on exertion. Sometimes, thin-walled bronchial veins rupture due to pressure, causing hemoptysis, and later dilated. As the right side of the heart fails, this leads to swelling of legs, ascites, and enlargement of the liver, and functional secondary tricuspid regurgitation and pulmonary regurgitation may develop. General appearance: blue face and malar rash may present. Apex beat. Tapping of apex beat, S1, initially loud, but when calcification occurs it becomes soft. S1 also shows paradoxical splitting, means narrow S1, single S1 and reverse split S1. S2, S3 normal, S4 is absent. Murmur of mitral stenosis is mid-diastolic, starts with large opening snap and ends with pre-systolic accentuation. Best heard at mitral area. JVP shows prominent a wave secondary to pulmonary arterial hypertension. Diagnosis. Investigation of choice is transthoracic echo. ECG depends upon which chamber is enlarged. If left atria is enlarged it shows P mitral, means duration of P wave is more than 120 milliseconds. If right atria is enlarged it shows P pulmonal, means amplitude of P wave is more than 2.5 mm. Treatment of mitral stenosis depends on severity and symptoms. All patients are advised lifestyle modification, avoiding exertion, and prophylaxis against infective endocarditis and rheumatic fever. Medical therapy includes diuretics for pulmonary congestion, beta blockers or calcium channel blockers for rate control in atrial fibrillation, and anticoagulation if AF or thrombus is present. Definitive treatment is interventional, percutaneous balloon mitral valvotomy for suitable valves, or surgery such as open commissurotomy or mitral valve replacement in advanced cases.